Classic symptoms of acute myocardial infarction include substantial chest pain radiating to the left arm and jaw, as well as diaphoresis. The coronary arteries are specialized in that they supply the active heart muscle with oxygen-rich blood. Each coronary artery supplies a different region of the heart with blood, as delineated by the 3 different colors used here. The 12-lead electrocardiogram, or EKG, records cardiac conduction in the various regions as shown. The right coronary artery, shown in blue, is represented by leads 2, 3, and AVF. The left coronary artery, in gray, is represented by leads V1 through V4, and the left circumflex artery, in tan, is represented by leads 1, AVL, V5, and V6. This is a close-up view of a simulated QRS complex and T-wave. Note the relatively flat ST segment and the upright T-wave. Both are normal and indicative of normal conduction. A close-up of the right coronary artery allows a cross-sectional view of plaque development within the vessel. A lengthwise view shows the same, and the narrowed lumen is seen to partially obstruct blood flow through the coronary artery. Plaque within vessels can rupture, releasing clot-promoting factors into the bloodstream. Blood flow slows in the presence of clotting, and eventually the vessel may become completely occluded. The location of the obstruction within the coronary artery determines the distribution of cardiac tissue that depends on this flow. This dependent tissue, shown darkening, will gradually infarct once deprived of its oxygen-rich blood supply. The representative EKG changes in myocardial infarction are outlined in red, with the ST segment becoming elevated. Within the bloodstream, myocardial cell death leads to the release of cardiac enzymes that can be measured in the laboratory. The most aggressive medical treatment for a myocardial infarction is a thrombolytic drug. The medication is given intravenously and as promptly as possible in order to limit the extent of myocardial damage. Since thrombolytics will lyse clotted blood anywhere in the bloodstream, it is important to examine the patient and ask about susceptibility to bleeding. The thrombolytic acts to dissolve the clotted blood, resulting in reperfusion of the artery, distal to the clot and the region of cardiac tissue dependent on that blood supply.